With a total of about 320,000 people, MAKONI district is one of the hardest hit among Zimbabwe's eastern province, MANICALAND district, by the novel coronavirus. Implementing partner, development aid from People to People Zimbabwe, through its partners UFF Humana and the Danish Emergency Relief Fund, saw the plight of the MAKONI people and responded to the national cause by lending a hand to the government of Zimbabwe. Working in all 49 wards in the district, Dapp Zimbabwe is implementing a project named Early Actions to contribute towards containing the spread of the COVID-19 epidemic and decrease morbidity and mortality among vulnerable people in MAKONI district in Manicaland province, Zimbabwe. Using a range of community-based approaches and trainings to give communities the skills and confidence to prevent and manage the coronavirus, Dapp managed to successfully reach many with its outreach awareness campaigns in and around MAKONI's capital, Rusape.
Ndinofara kutaura nemi zuva ranhasi. Mashoko amuri kunzwa pano, mashoko eupenyu nerufu. Saka zvinodaiwa kuti usarudze chaunoda, kuti rufu here kana kuti kupona, nekuti tiri kuudzwa nzira dzakawanda dzekudzivirira nadzo coronavirus. Ngatipfekei mamaski semataurwa azviri kuitwa. Ngatipfekei mamaski, tisapfekere mamaski mapurisa. Nekuti upenyu ndehwako, saka ukazvichengetedza wachengetawo nemunekidzo wako. Ngatikurudzirane kuti pese patiri tichibuda mumba kageti, ngatipfeke maski yangu. Ndione kuti ndakapfeka zvakanaka here nemazvo ndakavhara mhino, pasina hwambadzo unosara kuti mhepo ipinde.
The awareness campaign's main thrust was to ensure that communities and people know how to prevent getting infected by COVID-19 and how not to spread the virus to others, and most of all, to pass on the message to the next person.
Dzidzatawana pano nhasi nekuda kweroad show iri kuti simbisa kuti tingopfurire mberi nekuti tiri kuzwa kuti chirwere cheCovid-19 hachisati chapera. Saka tinofanira kuramba tichingopfurira mberi nemamaski edu, chifurira mberi nekuti vanhu vageze maoko vasati vasvika pano pamusika vachitenga zvinhu zvavo, zvinhu zvakachena zvakaratidzika.
Maorganization akaita seDapp sekuuya kwavaita sanhasi, vauya vachikurudzira kuti tinofanira kugara takaisa maski dzedu pamhino, tinofanira kudya chikafu chinopisa, tinofanira kusanitiza maoko edu. Tichishanda pabasa pedu saizvozvo izvo, tinofanira kunga tiine sanitizer yedu, bhaketi redu nesipo yedu. Pakasvika customer ichida kutenga, tofanira kutanga tamugezesa maoko omusanitize. Tinokurudzirwa kugara kudzimba, tofanira kugara takapfeka maski yedu kuti tinge tiri vanhu vakadzivirirwa pachirwere chedu cheCovid-19.
Among other people reached by the outreach were public transport drivers, conductors, and vendors. Them being people who work with large numbers of people daily, they were guaranteed to pass down the coronavirus message they got from the awareness campaigns to the next person.
Tadzidza kuti vanhu ngavapfeke mamaski tidzivirire chirwere ichi chisapararire ba. Mukombi medu vanhu vari kupinda kuti tichisanitiza tichikurudzira kuti vanhu vapfeke mamaski. Zvinova izvo zvinobatsira kuti chirwere ichi chisapararire.
Tafarirawo Dapp yauya yadzidzisawo futi kuti COVID iriko zveshuwa, munofanira kunge uchitsvaga maface masks kwakuti sanitizing inodiwa, mvura yekugeza maoko zvese, saka izotadzidzwa zvakanaka pane chirongwa chauya ichi. Saka tikuona zvinhu zvakanaka izvizvi. Chatoti tikasvika kumba takutoti kumadzimai nehama dzepadhuze tichivadzidzisawo zvetanzwa kuno.
To ensure that everyone was reached by the coronavirus message and was aware of the prevention measures required, Dapp took its awareness campaigns to Diamond FM, the provincial radio station. The message will not only reach all 300,000 people in MAKONI district, but more Manicaland province inhabitants and even more people through the station's online streaming service.
Dapp is using a sort of different communication mechanisms. So Dapp is disseminating its
information about COVID-19 and TB through SMS messages. And it's holding some educational programs through Diamond FM to publicize, to teach, to inform, to educate people about TB and how to stop the spread of coronavirus.
Coronavirus inogona kudzivirirwa kuburikidza nekuchengetedza utsanana. Gezai maoko enyu nesipo nemvura inochururuka kana muchipepa varwere mushure mekushanyira zvimbuzi uye musati mabata chikafu. Ndingaderedza sei mikana yekutapurirwa COVID-19? Usaenda padyo nemunhu ane zviratidzo zvechikosoro. Kana uchikosora, vhara muromo wako negokora, nejira kana tishu. Kana uchinge une zviratidzo zvakadai sekukosora, kupindwa nechando, kunetseka pakufema, tsvaka rubatsiro rwekurapwa nenguva. Mashoko aya munoaunzirwa neDevelopment Aid from People to People neDanish Emergency Relief Fund. Beneficiaries were also taught affordable means of practicing basic hygiene and sanitation, like the making of tip taps. To make a tip tap, one needs a clean plastic container, 3 wooden sticks which are dug into the ground, and a string which works as a lever that one steps on to tilt the container, allowing sanitizers or water to pour out. Coronavirus SMS alerts were also sent to the bulk of the MAKONI district population. While not all of the inhabitants have them, the majority own mobile phones and receive the coronavirus awareness alerts, thanks to Dapp.
As Minister of Information, we just extend our gratitude to Dapp for its support of COVID-19 mitigation programs, especially through Dapp.
Rusape General Hospital is located in the northeastern part of Zimbabwe and is the largest hospital in the district. With the outbreak of COVID-19 across the country, the district was not spared, and the hospital resorted to turning one of its wings into a COVID-19 isolation unit. However, the lack of proper equipment and protective clothing remained a challenge for doctors and nurses providing care for those infected. Development Aid from People to People Zimbabwe, in partnership with the Ministry of Health and the District COVID Response Task Force, reached out to UFF Humana and the Danish Emergency Relief Fund to assist in containing the spread of the COVID-19 in MAKONI district. With its partners, Dapp donated an oxygen ventilation system which generates and supplies oxygen to the 16 hospital beds in the 2 wards at the isolation center. A 5,000-litre water tank, which now provides running water for the health facility, was erected at the hospital courtesy of Dapp and its partners.
Development Aid from People to People has been so helpful in the district since 2017. They've managed to help us in quite a number of ways, even before the beginning of this COVID pandemic. Initially, they donated a very crucial machine called the Gene Expert machine, which we were using to diagnose, or we are currently using to diagnose TB. And we are now using it to diagnose COVID as well, the Gene Expert machine. And they've managed to donate as well hospital equipment, including beds, wheelchairs, office furniture for the hospital and also for the district. And with the coming of this COVID pandemic, they have extended their hand in assisting in refurbishing our isolation center. As we speak right now, we have a piped oxygen system that we didn't have before this organization. They've managed to assist in connection of water into one of our facility, which was lying idle, and they've assisted in connecting clean water to that facility.
You know, government doesn't have money to put some of the resources within the premises. Like when we are talking of this, our hospital, Rusape General Hospital, this is the biggest hospital within Makoni, and it's only the one hospital. And with this funding from Dapp through UFF, Dapp managed to install oxygen system. There was no oxygen system at that center, and even the system of water. Now there is water in the ward. Previously there was no water, but now through this partnership, there is water now.
Despite it being a big referral health institution in the district, the hospital had been operating without an ambulance for years. In the worst cases, patients who had to travel long distances on foot to get to the hospital died on the way.
This ambulance, we are saying, to ease the transport for the patients from the hardest to reach area.
Through the Early Actions Project, Dapp is working closely with Rusape General Hospital, has also come to the rescue of these patients and donated a top-of-the-art multi-purpose ambulance that is meant to reach remote areas and ferry patients.
Standing here on this momentous occasion where we are receiving a big and most significant donation from our partner DAPP, and this is not the first time that they've extended their generous hand towards our district. They came up again with another big surprise, an ambulance. And it's not just a vehicle, but an advanced life support ambulance, like what you have seen.
Mama ambulance atosiona ari pama-government institutions. Anenge aringori just motor, inenge ingori nestretcher inongotora munhu ichienda naye. But what through Dapp and pro-choice was done here was to configure the ambulance for it to suit my standards and in a private ambulance. You would notice that there's a provision of which panes for as much stocking as possible, because the aim iripo ndeyekuti ambulance iri kubuda yakaita seinoyi ngainge ichikwanisa kuitika zvokwanisa kuita pachipatara pari pasini pane murwere.
We are quite elated as a district with the way they have been faring and helping to bridge the gap between government and these people and complementing the work of government. We are quite happy with the work they've done. We want to very much heartily thank the interventions that DAPP has done in MAKONI, and we would wish that they would extend their scope and thrust to other areas in the district. You understand that they only cover a small portion, and there are a lot of players, but we feel more still needs to be done in the district to assist our people. And if funding can be allowed to assist in that regard, we'll be very much happy.
When I first visited Dapp, I had so many problems with my chest. I could have chest pains, side pains. Then I decided to visit a health center. They tested me twice through a sputum conducted. Then the third time, I visited Dapp after hearing from another health worker. Then I paid a visit to Dapp Rusape. They gave me a form, filled it, and transferred me to Rusape General Hospital for me to have a chest X-ray, which then later detected that I am TB positive. After the 2 tests collected from the sputum tested negative. Then soon after that, Dapp made a very big effort. They referred me to the local clinic. Then I have been taken onto the treatment.
Years of drought, rising inflation, and massive job losses have had a major impact on the majority of the Makoni population, which was struggling to put food on their tables. The COVID-19 pandemic has severely worsened the existing food crisis. Lockdowns and restricted movements have had a huge impact on families' abilities to earn money for food. Dapp, through its partnership with UFF, Humana and DERF, came to these people's aid and donated food hampers worth 10,000 United States dollars to 500 Makoni villagers. These included 155 people living with HIV, 248 pregnant mothers, 17 tuberculosis patients, 25 child-headed families, and 55 elderly people.
We have reached 10,252 households, of which we registered all these, and in collaboration with the Ministry of Health and Social Welfare, we identified 500 beneficiaries, where we are saying these 500 beneficiaries are in categories of those who are on ART and TB, those who are elderly, those who are child-headed families, and pregnant mothers. They all got some food hampers. They also benefited from reusable masks like this mask which I'm having. They can wash it and they can rewear it. Besides benefiting from these food hampers, they also benefited from horticulture seeds in 4 varieties, which is rape, kovo, onion, and beans. And for these gardens, we said we should establish 25 of them, but so far we have established 18, and we are still in the process of establishing others, like 7, which is remaining. These gardens, we are saying people should be in groups so that they can also discuss more on adherence, challenges, and experiences, so that everyone will take the treatment or the medication which they are prescribed by the doctor as normal.
Ndaisenza kumutawa kumbiri kukamurehwa uko covid yauya takabva tanzi ndaikumba hapana kana mari tasvika kunokumba kaupenyu kakataka kuti mai vaitawo zvemusika uchitengesa pabvavharirwa nepamusika taapamba kuti atiwa ndatajera kubata tumari nekudyiwa muriwo nemafuta usina mafuta zvabva zvakwanza mene kuti dhapu yakabvawa neni uyai kudhapu taenda kudhapu kuya takatobva kuti gorosari panaponopo hatiri kuita zimafuta 2 kg shuga 10 kg yeupfu ipanoi taakuda kusvika mukurima tapiwa mbeu dzimwe dzemuri kuona idzi tiri kutodyara masiromo takapiwa dzemagadheni miriwo tikarima dai kwakusi kuti misika yakavharwa tingadai takatoita zviri nane bhozi madomasi akaita asi bhinzi tine zvikoro zvakaita sana mabvudzi apa vanotenga bhinzi zvakanaka fani ndosandati handiendesi kuchimbi kusangana ndoendesa kune zvikoro izvozvo vana mabvudzi tinana John Kawa apa vana St Faith vanotenga zvakanaka fani.
During my first 2 months, which is the intensive period, I was suffering a great lot, but in the 2nd month, Dapp helped me to a greater extent through giving me a food hamper and a mask. That food hamper helped me to support and improve my immune system through boosting my health whilst I was having deficiency since it was during the lockdown period.
The project managed to contribute towards containing the spread of the COVID-19 epidemic in MAKONI district and left it equipped with preventative information, personal protective equipment, an ambulance, and an oxygen ventilation system at the isolation center. Dapp Zimbabwe, reaching 10,000 plus MAKONI people through humanitarian interventions.